It's the injury of the week. Wah. Marco Royce has injured his ankle again. Marco Royce will probably go down as one of the most injury-prone players of all time. Transfermarkt have 5 pages of injury history for this fella. And look, he's had all sorts of injuries, but one that seems to keep cropping up with him is ankle issues. The most notable one, of course, back in 2014, just before the World Cup, he suffered an ankle ligament sprain, which kept him out of the World Cup, which Germany ended up winning. Heartbreaking. He's very shy, this fella. He wanted to go to a dance the other day, but he had no body to go with. Can't be too shy though, because his feet are going out all over the internet now. For free? So 85% of all ankle sprains are lateral ankle sprains, so the outside of the ankle here. And there's a few bones and ligaments that we'll introduce you to now. So we have the talus bone here, we've got the fibula, and then we have the calcaneus, which is your heel bone here. And ligament-wise, we can't see them here, but we have the ATFL, which is your anterior talofibular ligament, so it goes between there. We have your CFL, which is your calcaneofibular ligament, goes here. And then your PTFL, which is your posterior talofibular ligament. Other lovely options you can have for ankle sprains include medial ankle sprains. Deltoid ligament there is a lot stronger and more fibrous, so it can resist a little bit more. You can have high ankle sprains, which will involve the syndesmosis. You can have midfoot sprains, so on. And out of all of those ligaments on the lateral side, the ATFL, the one at the front, is the most likely to get injured. And if we're talking about mechanism of injury for lateral ankle sprains, it's quite common knowledge, straightforward. It's rolling your ankle. Marco Royce does a great job of demonstrating this in the injuries. It's plantar flexion with inversion of the foot. And there's some evidence to suggest that the more plantar flexion that's involved, likely the more severe the injury is going to be. And obviously there's a few other factors that will come into play when you're talking about how long someone's going to be out for. If we look at these 2 examples from Marco Royce himself, back in 2014, this one happened where the player came in and smashed into the side of him, forcing him into more extreme inversion. He was out for 45 days after this one. But the more recent one, it was just his body weight. He landed on it and it rolled a little bit. So it's a little less severe. We'll talk about that in a little bit. So the first thing the medical team would be doing with Marco Royce is checking for any fractures, specifically of the fibula. We use something called the Ottawa ankle rules. They're just most commonly fractured bones with ankle injuries. You have to make sure that they're clear before you go into the ankle rehab. Then we look at classification of it by grades. I've seen a few of them, 1, 2, 3, 4, 1, 2, 3, depending on which ligaments are involved. Sometimes we just go for mild ankle sprain, then we have moderate ankle sprain, and then severe, which will be kind of complete ruptures. So whichever grades you're using, normally the milder ankle sprains, they'll kind of heal on their own within 2 weeks. And these aren't really sent for routine physio or anything like that, and there's not really any intervention that's properly required at the minute. But these actually have a 70% recurrence rate. So if you've had one mild ankle sprain, you're 70% more likely to get another one. So the guidelines around that are a little bit questionable at the minute. Personally, I think we should be rehabbing these ankle injuries, especially with a lot of research coming out that ankle sprains really benefit from early weight bearing and mobilization rather than being locked in a boot or anything like that. So essentially, as soon as you're done with icing it and compressing it, doing that traditional stuff, you should get weight bearing on almost as soon as you can tolerate it, given that a fracture has been cleared or anything more serious. So balance and strengthening exercises are going to be absolutely crucial for Marco Royce in his return. And when he's going back to sport, this is actually one of the very, very few cases where taping the ankle actually has a good evidence base behind it for preventing recurrence in the first few weeks. And this is probably a good time to mention that 20% of people with ankle sprains go on to develop something called chronic ankle instability. This is something that essentially happens from repetitive ankle sprains over and over again. It kind of compromises the strength and integrity of the muscle stabilizers of the ankle, and it essentially fries the nerve endings in your ankle. So it's very hard for your foot to know where it is in space. So this in turn leads to poor reflexes in the ankle, poor strength, poor control, which leads to more ankle instability, more ankle sprains. And due to the absolute amount of ankle sprains that Marco Royce has suffered, he's probably in that 20%. So people, do your rehab. So with the World Cup fast approaching, it was a major worry that Marco Royce was going to miss yet another World Cup. But the team are happy. It looks like it's only a mild sprain and he should be out just for 3 to 4 weeks. And that's the injury of the week. See you later, bud. Jesus.